Keep pulling. 3, 4, 5.
Okay, we're here today with Larry, and Larry's about to start his treatment with Dr. Davis. So, Larry, how long have you had the knee problems?
Over 2 years.
2 years, and it just gradually came on?
Yes.
Okay. Have you seen any other doctors for this?
Yes.
What doctors have you seen?
Orthopedic.
And what did they tell you?
They said I need a knee replacement. They injected knee.
They did the injections?
Probably 4 or 5 times so far.
Did they help?
They helped for a month.
And then it came right back?
Yes.
Oh, that's not good. So, what is your discomfort level, Larry? 0 being no discomfort and 10 being unbearable. What would you say that is?
Well, with no pain medication, I'm at a 10.
Right.
With pain medication, it comes down.
Right. So you're trying to
Bearable.
get away from the pain so you can get away from the pain pills. And with your line of work, what do you do for a living?
Air conditioning.
So you're constantly moving around. You're in weird positions, and it's very difficult.
Ladders, yeah.
Up and down ladders. Oh gosh, I can't even imagine. All right, Larry, I'm going to have you do a couple different exercises. If you could stand up for me. Any discomfort there?
Oh yeah.
I saw it in your face.
Back.
So it bothers your back too?
Yes.
Okay, and where does it hurt on your knee?
Really, it's it's inside.
Okay.
It's in the knee. So.
All right. Let's do a squat, Larry. So arms straight out in front of you. How low can you go? Okay, slowly come back up. Where did you notice it there? What was hurting when you did that?
My knee and back.
Your knee and low back.
Yeah,
Okay.
neck.
All right. And your neck too?
Yes.
So all of that got all tense? Okay.
Yeah.
All right. I'm going to have you go up and down the stairs for me if you could.
I usually go this way.
Okay. All right. Totally understand. I'm going to have you go back up the stairs. So any discomfort going up and down there?
Not really. Just the lower back, yeah.
That lower back, that's
And
what's
my
bothering
neck's-
you the most? Okay.
Neck's tight.
Out of all those exercises, which one bothered your knee the most?
Squat.
The squatting. That was causing the biggest problem.
Yes, and getting up.
And getting up from a seated position. All right, let's get you started.
2, keep pulling. 3, 4, 5, 6, 7. Deep breath, pull. 1, 2, 3, 4, 5, 6, 7. Good.
All right, we're back with Larry. Larry's finished his first treatment with Dr. Davis. So, Larry, can you stand up for us? All right. How was that?
That was all right.
All right.
Before.
Okay, let's do that squat. That was your
Oh, yeah,
biggest
that
problem,
squat.
was that squat.
That's right.
Yeah, let's see how that goes. Whoa, you're almost sitting on the bench. Come on back up.
Yep, definitely better.
Definitely better?
Yes.
All right, now let's try those steps, okay?
Yeah.
Let's try 1 foot per
Right.
step.
Right.
You got to think about it.
There we
Yep,
go.
you got to
Yeah.
think about it because you're used
I
to
do.
doing the 2 steps. Yep.
Yep.
Look at that.
You may see.
Tandem stepping. Look at that.
Yeah.
So, what changes have you noticed, Larry?
Well, it's a lot easier.
It's a lot easier.
before, yeah.
Less pain,
Definitely.
more flexible.
More flexible.
Right.
Less pain.
All right.
Yep.
So your discomfort level was an 8 when you started. What do you think it is now?
Now I'm about a 3, maybe.
That's
4.
great. And we haven't even done therapies yet.
Right.
All right, let's go.